thank you all for being witnesses here today to help us all learn and understand the varied perspectives across a really rich issue environment. Mr. Sneed, there was an exchange between you and Senator Graham about the state of IVF in other countries around the world, where you talked about the sort of regulatory framework that other countries around the world have relative to IVF, and as well as like the gestational periods. And correct me if I'm getting any of your testimony incorrect. Can you speak to the state of paid medical family leave or paid medical leave in those countries as well?
It's an excellent question, Senator. And I think in many of those countries, there's more support for people who have families. And I've argued in print and elsewhere that if a person wants to be comprehensively pro-life, that has to be part of the picture. You have to provide a safety net and support for moms and babies and families.
Totally appreciate you raising that point, because my next question is going to be about the state of childcare in those countries, and we can go down the list. All of those countries also have a higher minimum wage than $7.25. All of those countries also allow workers to unionize without intimidation from their employer. All of those countries also provide comprehensive health care and retirement security for the residents in those countries. Am I characterizing that accurately?
It's obviously a complicated question because we're talking about a lot of countries, but I think that there are many instances in which they do better than we do in those respects. Yes, ma'am.
I appreciate you helping me to bring this into perspective and really try to understand the juxtaposition and the tension that we find ourselves in, this sort of uniqueness in spaces. I think that's the word you use, the sort of U.S. Uniqueness, as there are many other ways in which the U.S. Is unique, in ways that it is not advancing the equivalent supports for families for life as those other countries that are being compared to. There's an interesting other sort of irony that I wanted to sort of call forth in the sort of pro-life argument as it's being presented here, and that is the irony of that argument sort of juxtaposed with the criminalization of patients and physicians. I find it ironic, and I direct this to you, Dr. Denard and Ms. Rivera, find it ironic that the folks who are doing their best by way of presenting as patients in need of a healthcare procedure, a full spectrum of healthcare procedures that women often need that are different than men. That then the punishment is a criminal record, years in prison, and losing your livelihood to provide for the family that is a demonstration of this value of life. Can you talk, you spoke a little bit, Dr. Denard, about the trends that you're seeing in the OBGYN space in Texas. I wonder if you could offer just quickly a little bit more of what you are seeing. What are OBGYNs talking about? Are there more medical school students, for example, that are choosing to, on match day, practice in the OBGYN space?
Thank you so much for bringing this up, and you speak so eloquently. You take the words out of my mouth, really, when it comes to the irony that we're all facing. We are seeing that states like Texas are less desirable for medical students that are coming out of their training because the training is different now in our state due to these ridiculous regulations, to be quite honest. And when I went to medical school, I went because I wanted to take care of people. I didn't think I was going to have to worry about being criminalized or being thrown in jail. I just want to take good care of my patients. They're like family. I see patients who come to me in college wanting to talk about contraception, and then the next year they come back, they've met someone, they're getting married, they want to talk about starting a family, and then we go through pregnancy together. And it's a really, really important relationship that we have with our patients, but it's becoming really traumatizing.
Thank you so much. And Mr. Chair, if I might just close, I do look forward to working with my colleagues to make sure that we repeal the Trump tax cuts for the wealthy so that we could actually do some of the things that other countries are doing to wrap around the kind of full service of life and protection of life that other countries around the world are doing. Thank you all so much. Thank you, Mr. Chair.